Hey guys, Dr. Rob here, and I wanted to welcome you to another one of my whiteboard sessions where today we're going to discuss is the protein, the meat that you're eating poisoning you? 1, what are the symptoms of it? 2, how do you test for it? 3, what are the causes? And 4, what can you do about it? All of that coming to you right now in today's video. But before we get into it, please make sure you take a second, hit the notifications button, hit the subscribe button if you're not already subscribed. And if you like this video, please make sure to give me a thumbs up at the end of it, share with your friends, and let's get rolling. So first off, what do I mean by protein poisoning? I simply mean the protein that you're eating is rotting in your gut and it is poisoning you. It's forming things like indole and ammonia, and it's literally creating poison. And what are the symptoms of that? The symptoms are brain fog. Well, if you're getting poisoned, you're of course going to be a little off, right, with the brain. Memory issues, like short-term memory in particular, not so much long-term, but short-term, like I really came into this room with the sole purpose of doing something and I have no idea why I'm here. It's like, God, I've arrived. I'm like Moses. I'm here. Please show me a sign, right? So the next sign, joint pain, because these poisons are entering into the bloodstream and they are starting to inflame the joints and make you hurt. So full body inflammation. This is swelling. This is a puffy looking. This is your whole body just kind of aching. Bloating in the abdomen, because when things rot in the gut, they form and produce gas. So you get just a bloating in the belly. Foul smelling gas, of course, if things are rotting, they're going to stink. Abnormal body odor or vaginal odor. So some of these toxins get into the bloodstream and they get pushed out through the skin. They could also affect the pH of the vaginal tract and create vaginal odor, as well as just your body might be kind of a bit smelly, more smelly than normal. You might notice it for sure after exercise or working out. And then the last symptoms is heartburn, indigestion, or GERD, the inability to keep the food in your stomach. It's basically refluxing back up. So I am not saying don't eat protein. I'm not saying animal protein is bad. That's not what I'm saying. Some people do great on carnivore-oriented diets. Perfectly fine. Their genetics indicate it. Their testing indicates that should be fine. Other people need a vegan-style diet. We're talking about this one specific thing, which is some people are eating animal-based proteins, and because of certain factors, which I'm going to talk about right now, they can't digest it. So what's the factors? 1, they're not chewing their food enough, right? Imagine trying to swallow a whole hunk of steak. It's just going to sit in your gut. You're not going to be able to digest it all. So you're supposed to chew your food, believe it or not, 32 times. I know it's a lot. The second problem is an H. pylori infection in the stomach. This is a bacteria that interferes with your ability to produce stomach acid. If you can't make stomach acid, then you're not going to be able to digest your proteins, especially your animal proteins, very effectively. In addition to that, simply low hydrochloric acid production. We move on down the gastrointestinal tract a bit, and we have low pancreatic enzyme production. Very easy to test for. All these are very easy to test for. I'm going to tell you in just a second. And then as we get down into the middle gut, we have SIBO that can sometimes do this. And then we have imbalances in the beneficial bacteria in the colon, which create pH imbalances through up, which can interfere with protein digestion. So these are the things that typically cause it. So how do we test for it? Well, look, here's the easiest way to see if you got it. You do a urinary Indicin test. Now, I posted this on Instagram and someone said, oh, you must mean urinary indicator test. No, urinary Indicin. Someone else said, oh, you must mean urinary iron. No, urinary Indicin is the name of the test. Urinary Indicin, Indican. It's very inexpensive. You can get it for anywhere from $25 to maybe $100. I would say the average is probably about $75, $50 to $75 for this test. You can grab it online. It's a simple urine study, easy peasy to do. And what does this show us? Well, when protein is rotting in your gut, your bacteria work on it. And they alter it. They run it through a process called putrefaction. This is the inability to digest the protein. The protein rots. So the bacteria start to kind of almost ferment the protein, but they're not fermenting it. They're really putrefying it. So this is putrefaction. When this occurs specifically to the amino acid tryptophan, you produce what are called indole. You produce indole. Indole is a toxic substance. So when indole is in your gut, it always indicates a toxic bowel. So Indicin is an indicator of indole. So urinary Indicin test is the test for this to see if this is the issue. And if this is the issue, what do you do? Well, I'll tell you in a second. So first thing you got to do is you have to find out why is it there. So you can do an H. pylori stool antigen study. You can do an H. pylori breath test. You can do an acid test where you take a tablespoon of apple cider vinegar. If that causes burning or aggravation, that's probably not the case that you have it, or you might have it, but you need to take Tums to neutralize it. So you could do an acid test, and you could see if any gut symptoms you have improve with the use of apple cider vinegar. If they do, you might have low stomach acid. So then the next thing is you can actually do a PCR DNA probe stool analysis, which is a very in-depth way of looking at the beneficial and harmful bacteria in the gut, as well as parasites, yeast, fungi, mold, things like that. You could even look at viruses that shouldn't be in the gut that way as well. And then you could also pull a marker called elastase-1, which looks at pancreatic enzyme production. Are you producing enough enzymes to digest animal protein in the first place? So those are all the more complex functional labs. We do all these in our clinic, of course, but these are the more complex functional labs that, geez, we've been doing for years and years. We've been in practice for 25 years, so we've been doing this for a while. But those are the labs you want to look for. But the first one, before you do any of that stuff, is you go and you do this urinary Indicin test, which is pretty cheap and really effective at letting you know if you have it. So if you do have it, what are some solutions? Well, it depends upon what the root cause is, right? So your solution is going to be very specific to root cause. So in my clinic, we're always looking for what's the root cause, the reason why a person has a symptom. If you have heartburn, indigestion, bloating, constipation, diarrhea, thyroid problems, whatever it is, right? Autoimmune disease, what's the root? So what you're going to do is going to change based off of what the root is. But just some general things you can try. One, make sure you're chewing your food well. Two, you can try taking pancreatic enzymes, particularly protease. Make sure the protease is pH balanced. So you should have a protease in there that's about that's active at 6.5 pH, another protease that's active maybe around 5, and another protease that's active somewhere between 1 and 3. So that way you're getting full digestion of your protein throughout your bowels, because different versions of protease, which is the enzyme that digests protein, are active in different pHs. So you want to get a pH balanced protease enzyme supplement. You, of course, can try probiotics and prebiotics, and you can try adding foods to your diet that actually aid in the digestion of protein, things like mango as well as papaya, and you could even try papaya enzymes. Papaya contains papin, which is a protein that really will digest it's an enzyme that will really digest animal proteins. So papain, which is comes from papaya. You can eat the papaya, you can take the enzymes. The papaya, I think, is better. But those are the different things. Now, if you have any questions, please put them in the comments below. And I'd like to hear, too. I'd like to hear from you guys to understand what you're going through. So please put them in the comments below. We'll do our best to respond. And again, if you like it, give me a like and hit the notification and the subscribe button. I'll catch you at the next whiteboard session. Thanks so much for being here with me today, guys. See ya.